it's a really exciting time for health reform in California right now. We've moved past the period of thinking a lot about coverage expansion, Medicaid expansion, and the exchanges. And we're going to need to spend a lot more time thinking about the healthcare system and how are we making it better to serve patients. I think in the Medi-Cal space, the 1115 waiver renewal is going to be the game changer, and how well we're going to be able to partner with the federal government in thinking about continuing to drive really innovative change in California. We have long been a leader in the nation in terms of what our Medicaid program is doing, the growth into managed care and providing a more organized delivery system for beneficiaries. And I think there's a lot of really exciting ideas in the Medicaid waiver about trying to address, again, those social determinants of health and to try to move beyond just how are we delivering medical care to how are we actually addressing public health in California. Right now, we're working with a couple of hospitals in New York on their recent 1115 waiver, which is trying to create networks of providers in the community, anchored in a hospital, but reaching out to community providers, long-term services and supports, and behavioral health to create a whole community of providers that wraps around the patient. We're going to be able to bring a lot of the lessons learned in New York to California. And so you're starting to get aligning of incentives across the healthcare system about delivering value. How are we thinking about payment streams and incentives? How are we thinking about how providers interact with each other? And are we giving them the right incentives to think about the bigger picture in terms of the health of the patient?